While epilepsy is the fourth most common neurological disorder and affects people of all ages,
women with epilepsy are especially vulnerable in both pregnancy and the menopausal transition.
Hi, I'm Dr. Lidia Moura, neurologist at Mass General Hospital.
And I am Dr. Paula E. Voinescu, neurologist at Brigham and Women's Hospital. And these are Mass General Brigham's answers to your most asked questions on epilepsy. What is the difference between having a seizure and having epilepsy?
A seizure is a short change in normal brain activity, which can cause, for example, a person to fall, shake, or lose awareness. However, epilepsy is when someone has recurrent seizures. If you have a seizure, there are a number of reasons that could be causing it. They are not necessarily related to epilepsy, such as a high fever, low blood sugar, alcohol, or drug withdrawal. So then, Dr. Voinescu, what causes epilepsy?
If we are speaking about the specific causes for epilepsy, it should be noted that for 2 in 3 people, the cause of epilepsy is unknown. This type of epilepsy is called idiopathic, where no brain abnormalities are found, and the brain function is otherwise normal. Some of the most common causes for epilepsy include brain tumors, traumatic brain injuries, strokes, and other vascular problems, brain infections from parasites, viruses, and bacteria, loss of oxygen to the brain, some genetic disorders such as Down syndrome, or other neurological diseases such as Alzheimer's. So, once you know what could potentially be causing epilepsy, Dr. Moura, how do you know if someone is having a seizure?
A lot of times, people think a seizure is only happening if someone is convulsing on the ground, but the signs shown depend on what kind of seizure you are having. Seizures are typically classified into 3 groups based on their beginning: generalized, focal, and unknown. Generalized seizures start at both sides of the brain. The signs we typically see are losing consciousness, falling to the ground, muscle jerks or spasms. Focal seizures start at one part of the brain and may or may not spread to the rest of the brain and look or feel like changes in sensations such as a strange taste or smell, being confused or dazed, unable to respond to questions or directions for up to a few minutes. A very important question patients ask is, can there be complications with pregnancy if I have epilepsy?
Yes, there may be, but the good news is that complications can be avoided if the pregnancy is planned. The largest rigorous study we have, called WePod, showed that actually women with epilepsy seeking pregnancy have similar likelihood of getting pregnant, carrying to term, and also similar live birth rates when compared with women without epilepsy. Children who are born to women with epilepsy may be at greater risk of birth defects when some anti-seizure medications are used, but that risk is reduced by selecting the right medication and dose and by supplementing with folic acid. Breastfeeding was also shown to be safe and beneficial for most women using anti-seizure medication and for their babies. So, if you have epilepsy and are planning a pregnancy, it is very important to consult your OBGYN and neurologist early for best prenatal care. What are the treatments for epilepsy?
The most common treatment for epilepsy is anti-seizure medications. These medications are effective in about 2 out of 3 people with epilepsy. When seizures come from a single area of the brain, focal seizures, surgery to remove that area may stop future seizures or make them easier to control with medicine. When medicines do not work and surgery is not possible, other treatments can help. These include neurostimulation devices. Some of them can monitor the brainwaves, looking for unusual activity, detect a seizure, and send brief pulses to normalize the brainwaves. So many patients ask, are there ways to prevent seizures?
There is no sure way to prevent seizure. However, if you have been diagnosed with epilepsy, I cannot stress this enough. Take your medication. Taking your medications as prescribed will lower the risk for seizures. Even if you're pregnant, continuing to take your medication is vital. Talk to your doctor about the risk and benefit of your medication.
Thanks for watching. For more videos from Mass General Brigham, click here.
And don't forget to subscribe here.